Nonverbal communication (NVC) between dental student providers and Spanish-speaking patients, a case study. Although NVC has been studied in other disciplines of healthcare, there's little data that exists in clinical dentistry. Literature highlights that provider NVC plays a major role in the clinical setting and is especially important when a language difference is present. Our case analysis highlights that the presence of a language difference in the dental clinic negatively influences providers' NVC. However, convergence techniques, which are strategies used to minimize communication differences between individuals, can be used to mediate such barriers. We aim to promote a greater understanding of NVC in dentistry and to overcome communication gaps and, in turn, inform dental education. The case study analysis focuses on 3 providers, A, B, and C, with varying degrees of Spanish fluency, who all exhibited differences in their NVC while treating their monolingual Spanish-speaking patients. Video footage was used to analyze providers' nonverbal communication, which was scored on a scale from -4, unfavorable, to +5, favorable. The nonverbal behaviors analyzed were adapted from the work of Dr. Albert Morabian and categorized as either immediacy, which included eye contact, body posture, and position, or responsivity, which included head nods and hand gestures. In order to ensure IRR, each researcher graded the same nonverbal behavior for all of the videos. Results for our 3 providers are depicted in Table 2. Favorable nonverbal behaviors were defined as positive numerical scores and unfavorable behaviors as negative. As seen in row 1, provider A, a bilingual English and Spanish speaker, received positive scores across all NVC categories. Provider B, shown in row 2, who partially utilized a telephonic interpreter, received a total NVC score of 4, with deficiency in 1 nonverbal subcategory, hand gestures. Provider C, score shown in row 3, who fully relied on the interpreter, received a score of 3. This provider had deficiencies in the subcategories of eye contact and head nods. The data proposes that more favorable nonverbal behaviors were observed in the providers who either shared the same language as their patient or employed convergence techniques. Additionally, it suggests that the language barrier and interpreter reliance appear to negatively impact the responsivity category more so than immediacy.
The provider's NVC scores suggest that monolingual patients should be treated by providers who share their language. Given that is not always feasible, convergence techniques can work as an alternative. The video analysis showed that provider B adopted convergence techniques to bridge the communication barrier, such as infrequent cell phone interpreter usage. More favorable nonverbal behaviors were seen in provider B's recording in contrast to provider C, who fully relied on the interpreter. Interpreter reliance appears to more negatively influence responsivity compared to immediacy. Providers B and C each received deficient responsivity scores in at least one subcategory, hand gestures and head nods respectively. These unfavorable scores were irrespective of convergence techniques. This suggests that convergence techniques may only positively modify nonverbal behaviors in the immediacy category. Depicted in Figure 1, we illustrate the interconnection between verbal and nonverbal communication and effective convergence techniques. Verbal and nonverbal communication are evidently intertwined. Especially when a language barrier is present, it is important to be aware of and utilize convergence techniques as a means to enhance NVC skills and minimize the care gaps. Modifications for the future include obtaining direct language fluency information from providers rather than relying on interpreter usage, and diversifying and increasing our patient and provider populations. We hope this presentation can inform and educate future dental practitioners about the importance of NVC and the role that it can have in enhancing the patient-provider interaction. Thank you for your time.